Achilles tendon is the strongest tendon in the human body, connecting the calf muscles to the heel bone and playing a vital role in walking, running, and jumping. Yet Achilles tendon ruptures are surprisingly common, especially among active adults aged 30 to 50. These injuries often occur during sudden acceleration or changes in direction, placing immense stress on the tendon, sometimes up to 8 times a person's body weight. When the tendon snaps, it can cause severe pain, swelling, and a noticeable gap above the heel. Diagnosis is typically confirmed through clinical tests like the Thompson test, which boasts high sensitivity and specificity. As the number of Achilles injuries rises, especially with an aging and increasingly active population, the debate over the best treatment, surgical or conservative, has become more relevant than ever. When it comes to treating Achilles tendon ruptures, two main approaches dominate: surgical repair and conservative management. Surgical treatment involves stitching the torn tendon back together, either through open, minimally invasive, or percutaneous techniques. This method is known to reduce the risk of a rupture, but it comes with higher chances of complications like infections and nerve injuries. On the other hand, conservative treatment relies on immobilizing the ankle in a cast or functional brace, allowing the tendon to heal naturally. While this avoids surgical risks, studies show a slightly higher rate of a rupture. Interestingly, long-term functional outcomes, such as strength, mobility, and patient satisfaction, are often similar between the two groups. The choice between these treatments is not clear-cut and depends on factors like patient age, activity level, and personal preferences. Systematic reviews of recent studies reveal that neither surgical nor conservative treatment is universally superior. Surgery tends to reduce rupture rates, but increases the risk of complications such as nerve injuries and infections. Conservative treatment, while safer in terms of surgical risks, shows a slightly higher chance of the tendon rupturing again, especially in the first 10 weeks post-injury. However, both approaches can lead to similar long-term function if paired with effective rehabilitation. Early mobilization and structured rehab protocols are key to optimizing recovery, regardless of the chosen treatment. The quality of the tendon after healing, its strength, elasticity, and thickness, may not fully return to pre-injury levels, highlighting the importance of tailored rehab. Ultimately, the best approach is a shared decision between doctor and patient, considering individual needs and lifestyle. Despite extensive research, there is still no gold standard for treating Achilles tendon ruptures. Both surgical and conservative options have their pros and cons, and the choice should be personalized. Recent evidence suggests that early functional rehabilitation can make conservative treatment nearly as effective as surgery in many cases. However, differences in study designs, patient populations, and rehab protocols make it challenging to draw firm conclusions. Future research needs to focus on standardized methodologies, longer follow-up, and more detailed subgroup analyses to better guide clinical decisions. For now, the most important factors remain patient preference, lifestyle, and a collaborative approach between patient and healthcare provider to achieve the best possible outcome.